Historically, pioneers, nomads, and Native Americans were able to meet their physical activity needs daily. They had to hunt and gather food to survive. Then, as agriculture came into formation, people no longer had to hunt and gather, but farming was also very vigorous work as well. But as supermarkets became readily available and technology improved, people have drastically declined their physical activity. Even with gyms and sports, people aren't nearly as active as they once were. That being said, we will discuss the importance of physical activity and daily exercise for our bodies. Body mechanics is a term we use to describe how our bodies move. Body alignment or posture is an important aspect of body mechanics. Proper posture places the spine in a neutral resting position. Good posture contributes to the normal functioning of the nervous system and improves feelings of well-being. For your body to be balanced, your line of gravity must pass through your center of gravity, and your center of gravity must close to your base of support. The line of gravity is an imaginary vertical line drawn from the top of the head through the center of gravity. The center of gravity is the point around which mass is distributed. In the human body, the center of gravity is below the umbilicus at the top of the pelvis. The base of support, which is what holds the body up. The feet provide the base of support. Coordination. Smooth movement requires coordination between the nervous system and the musculoskeletal system. Voluntary movement is the initiation and cerebral cortex. However, the cerebellum coordinates movements. The basal ganglia assists with coordination of movement. Damage to any of these areas will affect coordination of movement. For example, a stroke that affects this area of the brain will alter a person's gait and posture. Joint mobility refers to a person's ability to move. Range of motion is the maximum movement possible at a joint. Active range of movement is defined as the movement of the joint through the entire range of the motion by the individual. Full range of motion is part of being physically fit. For that reason, stretching exercises are included in a comprehensive exercise program. Passive range of motion involves moving joints through range of motion for the patient by another person, typically the nurse or the nursing assistant. Principles of body mechanics are the rules that allow you to move your body while reducing the risk of injury. Nurses must be very careful in lifting and caring for patients. So often anymore you hear of nurses and CNAs that hurt their backs or necks from improper lifting or lifting more than they should. Wherever you work as a nurse, your facility will have you complete a short course in proper body mechanics. These tips and tricks will save you from chronic back pain in the future, so review the principles of body mechanics on this slide. To maintain proper posture, it is important to B. Avoid arching shoulders forward when sitting. Arching shoulders forward when sitting alters the curvature of the spine and contributes to poor body alignment. The expected physiological changes associated with growing older make it harder to start or maintain an exercise program. The result is increased risk for chronic health problems. Obesity often leads to health problems, which indirectly reduces activity and can in turn contribute to further obesity. For example, joint injuries or osteoarthritis are more prevalent with obesity, which in turn reduces a person's physical activity. Unhealthy eating patterns such as large portions, consumption of convenience foods, and a diet high in saturated fat and simple carbohydrates plays a major role with the obesity problem. Although these obese people have plenty of calories available to expend on exercise, movement becomes more difficult as body size increases. Manual labor has declined and work environments have become increasingly sedentary. As a result, individuals need to look towards leisure time for exercise and fitness activities. This requires making time for exercise. People will also choose exercise depending on culture and feelings of self-awareness. Your book mentions a person who is very modest may not choose swimming as a form of exercise because they do not want to be seen in a bathing suit. A high stress level can produce fatigue as well. Although you may view exercise as one more thing you don't have time for, exercising is energizing and can be used to relieve stress. When a nurse is very stressed, you may hear them say, "I'm just going to go for a quick walk." This is actually a very good thing. It will relieve their stress and they can focus when they come back to work. Environmental factors affecting exercise include weather, pollution, neighborhood conditions, finances, and support systems. Weather has a strong influence on activity level. If educating your patient on incorporating exercise into their routine, they may mention that their neighborhood is not safe. You can mention the mall or large stores to walk in. They will be air-conditioned as well on hot summer days. Diseases and abnormalities in various body systems can negatively influence body alignment, balance, coordination, and joint mobility. Exercise is the contraction and relaxation of muscles and increases muscle tone and strength. 150 to 300 minutes a week of moderate to vigorous intensity exercise is recommended for good health. Isometric exercises involve muscle contraction without motion. They are usually performed against an immovable surface or object, such as pressing the hand against the wall. The muscles of the arm contract, but the wall does not move. Each position is held for 6 to 8 seconds and repeated 5 to 10 times. Isometric training is effective for developing total strength of a particular muscle or group of muscles. Isotonic exercises involve movement of the joint during the muscle contraction. A classic example of isotonic exercise is weight training with free weights. As the weight is moved throughout the range of motion, the muscle shortens and lengthens. Isokinetics combine the best features of both isometrics and weight training by providing resistance at a constant speed, preset speed, while the muscles move through their full range of motion. Aerobic exercise acquire energy from metabolic pathways that use oxygen. The amount of oxygen taken into the body meets or exceeds the amount of oxygen required to perform the activity. Aerobics use large muscle groups, and it can be maintained continuously and is rhythmic in nature. It increases the heart and respiratory rates, therefore providing exercise for the cardiovascular system while simultaneously exercising the skeletal muscles. Anaerobic exercise occurs when the amount of oxygen taken into the body does not meet the amount of oxygen required to perform the activity. Therefore, the muscles must obtain energy from metabolic pathways that do not use oxygen. Rapid, intense exercise, such as lifting heavy weights or sprinting, are examples of anaerobic exercise. Regular physical activity can produce many great long-term health benefits. People who have been inactive for years can improve their physical fitness by adding walking into their daily routine, or perhaps bike riding, which is much easier on the joints. Weight-bearing exercises are good for improving bone density. Exercise is also linked to the neurotransmitters dopamine and serotonin. Exercise gives you a natural high, which alleviates depression. There are several risks associated with exercise as well, especially for people who have not exercised in a long time. Several of these risks include cardiac and musculoskeletal injury, dehydration, hypoglycemia, and temperature regulation problems. A person may easily become more overheated or dehydrated. If a person is concerned about their physical activity limitations, they should consult their physician for checkup before starting an exercise program. Inactivity causes significant wasting of the gastrocnemius, soleus, and leg muscles that control flexion and extension of the hip, knee, and ankle. Confinement to bed leads to 7% to 10% loss of muscle strength per week. This is why getting patients up and moving in the hospital is so important. We used to keep patients in bed because rest was best, but when we discovered how much damage it was causing, we said get them up and going. Immobility also causes the joints to become stiff. The strongest muscles, usually the flexors, pull the joints in their direction, leading to contractures or joint ankylosis. This is fusion of the joints. When a patient is in bed, the depth of respirations decreases and secretions pool in the airways. The ability to effectively cough and expectorate secretions diminishes as muscle tone of the abdomen and chest decrease. As a result, pooled secretions block air passages, and alveoli decrease oxygen and carbon dioxide exchange and often lead to atelectasis, or pneumonia. In addition to venous pooling, immobility leads to compression and injury of the small vessels in the legs and decreased clearance of coagulation factors, causing blood to clot faster. These three changes, stasis, activation of clotting, and vessel injury, make up what is known as Virchow's triad, a trilogy of symptoms associated with a greater chance of thrombus formation, such as a deep vein thrombosis. Prolonged bed rest inactivates the baroreceptors involved with constriction and dilation of the blood vessels. As a result, when a person who has been immobilized changes position, he or she is less able to maintain his blood pressure. The patient complains of feeling dizzy and lightheaded and may be unable to support his own weight. As in glucose intolerance, as ATP concentrations decrease, so does the body's energy reserves. In response, metabolic rate drops, protein and glycogen synthesis decrease, and fat stores increase. Together, these effects cause glucose intolerance and reduced muscle mass. External pressure from lying in one position compresses capillaries in the skin, obstructing skin circulation. Lack of circulation causes tissue ischemia and possible necrosis or death. Nursing interventions include frequent turning and skin care to prevent wounds, also known as pressure ulcers, from forming. The best way to take care of pressure ulcers from forming is to turn your patients every 2 hours. Immobility slows peristalsis, which leads to constipation, gas, and difficulty evacuating stool from the rectum. In extreme circumstances, a paralytic ileus or a cessation of peristalsis may occur. When peristalsis slows, appetite diminishes and food also is digested slowly. The net effect is usually decreased calorie intake and inability to meet protein demands of the body. Being supine inhibits drainage of urine from the renal pelvis and bladder. Urine becomes stagnant, which creates an ideal environment for infection and kidney stone formation. Immobility triggers a rise in calcium levels, which also contributes to stone formation. Prolonged immobility, whether in the hospital or at home, leads to isolation and mood changes. In the 1960s, the effects of immobility were studied among astronauts. Along with many physical effects of immobility, these healthy men showed signs of depression, anxiety, hostility, sleep disturbances, and changes in their ability to perform self-care activities. Of the following interventions for the client who is immobile, the nurse will give priority to, and the answer is C, having the client use his or her incentive spirometers every 2 hours. The use of incentive spirometers helps to prevent atelectasis, which improves oxygenation, a priority need. You can assist your patient in creating an exercise routine that fits their fitness level. Explain to increase weights, incline on the treadmill, and resistance once they have peaked at their current goal. Having a friend to work out with will also help to continue on an exercise plan, and a friend can help push them to achieve more. Healthy people are able to position themselves in bed to maintain comfort. When people are sick or weak, they often need assistance with turning and ADLs. It is also a good idea to help them shift their weight so that pressure sores do not form. Aligning the bed to be in the correct position for the patient will help the patient to breathe easier, especially those with respiratory conditions. Elevating the knees will help to keep the patient from sliding to the foot of the bed. If a patient is bedbound, the nurse and nursing assistants will need to complete passive range of motion on the patient to prevent contractures from occurring. When trying to position a patient in bed, many facilities will offer special wedges, pillows, and sandbags to keep a patient in one position. Overhead trapeze devices will give the patient something to hold on to and help the nurse when lifting in bed, which will also help to prevent shearing on the bottom and back. The footboard is a pretty cool device that you can find in the nursing home. Frequently, that helps to keep the foot in a neutral position, thus preventing foot drop. Fowler's is an ideal position for some patients with cardiac dysfunction. Common variations include semi-Fowler's position, in which the head of the bed is elevated only 30 degrees, and high Fowler's position, in which the head is elevated at 90 degrees. The lateral position is a side-lying position with the top, hip, and knee flexed and placed in front of the rest of the body. The lateral position creates pressure on the lower scapula, ilium, and trochanter, but relieves pressure from the heels and sacrum. The lateral recumbent position is side-lying with legs in a straight line. With prone, the patient lies on his abdomen with his head turned to one side. This is the only position that allows full extension of the hips and knees. It also allows secretions to drain freely from the mouth and thus is helpful for an unconscious patient. However, this is the most difficult position to move an unconscious patient or frail patient into because it requires the greatest amount of manipulation to position the patient appropriately. Sims is a semi-prone position. The lower arm is positioned behind the patient and the upper arm is flexed. The upper leg is more flexed than the lower leg. Sims position facilitates drainage from the mouth and limits pressure on the trochanter and sacrum. This is an ideal position for administering an enema or perineal procedure. Supine, also known as the dorsal recumbent position, the patient lies on his back with his head and shoulders elevated on a small pillow. The spine is aligned and the arms and hands rest comfortably at the side. A transfer board is a wood or plastic device designed to assist the patient with moving. Using a transfer board reduces your risk of injury and promotes a smooth transfer. Place the board under the patient on the side to which he will be moved. It is best to use a draw sheet to slide the patient across the board. Transfer boards are also used by patients with long-standing mobility problems to increase their independence. A mechanical lift is a hydraulic device used to transfer patients. Place a fabric sling under the patient and attach chains or straps from the sling to the lifting device. A mechanical lift is especially useful when providing care for obese and immobile patients. Lifts are used in the home because they allow one person to transfer the patient safely. A transfer belt is a heavy belt several inches wide that is used to facilitate transfer or provide a secure mechanism to hold the patient when ambulating. Apply the belt around the patient's abdomen, close to the patient's center of gravity. The belt may have external grips or holds, or you may grip the entire belt with your hand. The patient may require physical conditioning if they have been confined to bed for more than a week. Working to strengthen the quadriceps and gluteal muscles, which are the largest and strongest muscles in the body. This will help to prepare the patient for walking again. Completing arm exercises will strengthen the biceps and triceps to help the patient with lifting his or herself up with a walker or using a wheelchair. Before trying to help a patient out of bed, assess their readiness for this task. If the patient is not mentally and physically prepared for such a feat, it will be likely that they will fall. If the patient is ready to move, make sure that all loose or unsteady objects are out of the patient's way. Ensure that they have non-slip socks on, no rugs to trip over, the walker is at the appropriate height, and they have a gait belt on for safety. One side note is if your patient is under your care because of dizziness or low blood pressure, make sure that they sit up on the side of the bed and then slowly rise, so as not to pass out. The sudden standing may actually cause the blood to leave the brain and oxygen levels drop, as will your patient. Identify the true statement about devices used when assisting clients to ambulate. And your answer is D. Each crutch walking gait begins with the client in the tripod position. The tripod position is the basic crutch standing position from which the client then moves forward.